Please understand that there are some technical issues that we may not be able to resolve. We are recording the webinar and we'll post it on our website by the end of next week. Dr. Aisha Delaney Brumsney, Director of Behavioral Health for the Council of State Governments Justice Center. Dr. Delaney Brumsney oversees the Behavioral Health Division at the Council of State Governments Justice Center, which focuses on reducing incarceration of and improving outcomes for people with behavioral health conditions. Before joining the organization, Aisha was the Director of Behavioral Health and Research and Programming at the New York City Mayor's Office of Criminal Justice, which she helped to advance a number of reforms, including increased investment in the city's crisis response services and supportive housing for people with history of justice involvement. Prior to that, Aisha was the Director of the Substance Use and Mental Health Program at the Vera Institute. Catherine Berry, Grants Management Specialist at the Office of Juvenile Justice and Delinquency Program for the U.S. Department of Justice. As a member of the Intervention Division at OJJDP, Catherine works on several program areas, including family drug courts statewide system improvement, family drug courts training and technical assistance, and, of course, juvenile justice and mental health collaboration. Prior to her position at OJJDP, she was the Director of Corporate and Foundation Relations at the National Center for Children and Families, a not-for-profit child welfare and adoption organization. At NCCF, she coordinated the planning, writing, and preparation of grant proposals for programming, managed grants received, and initiated and cultivated relationships with philanthropic organizations. Prior to that, Catherine was the Federal Programs Manager for Indigent Defense and AmeriCorps Legal Fellowship at Equal Justice Works. She was also the Interim Director at the Mid-Atlantic Juvenile Defender Center and a writer and editorial consultant for the National Juvenile Defender Center. Sarah Wurzburg, Program Director of Behavioral Health at the Council of State Governments Justice Center, leads the
Hi, good afternoon. This is Sarah Wurzburg from the Council of State Governments Justice Center, and I think we may be having some technical difficulties as Demetrius's audio just cut off, so I will jump in. I think he had been doing an introduction for myself, so I'm Sarah Wurzburg. I'm a Program Director for Behavioral Health at the Council of State Governments Justice Center. I oversee our substance use portfolio and oversee training and technical assistance to the Second Chance Act behavioral health focused grantees, in addition to providing support for behavioral health and housing systems analysis through the Justice Reinvestment Initiative. Next slide, please. So I'll pass it over to Catherine to talk about OJJDP.
All right, let's start my video so you can all see me and hear me at the same time. Welcome, everybody. So as Demetrius already mentioned, I'm Catherine Berry, and I'm the Grants Management Specialist for this program at OJJDP. And I have had the pleasure of speaking with each of you already, either via phone or Zoom. So some of what I say might be a refresher today. But as you may or may not know, the Justice and Mental Health Collaboration Program is a Bureau of Justice Assistance, or commonly referred to as BJA program. This year, BJA gave OJJDP the opportunity to manage programs that specifically focus on juvenile justice and mental health collaboration, which we enthusiastically accepted. So that is why you have me as a program manager at OJJDP rather than someone through BJA. So I manage those awards now, which is all of you, and congratulations on your award, and I look forward to working with each and every one of you over the next 3 years, maybe 4 if some of you need an extension. So I'm going to talk a little bit about the expectations we have of you, since each program was reviewed and selected based on criteria that uniquely qualified you as the most competitive. I wanted to lay out some of the specific expectations we have of you. We expect you to think about your systems, about how your systems can be more responsive to youth with mental illness and co-occurring substance use disorders in the juvenile justice system. We also expect that you will take on the planning process in collaboration with your TA coach, which we'll get into a little bit later. You will use validated screening and assessment for mental illness, substance use, and criminogenic risk. You will seek appropriate services and identify systems gaps for serving youth with mental illness in your jurisdictions. And that you will seek help when help is needed and communicate regularly with your technical assistance coach or myself. Your TA coach is going to be your subject matter expert, and I am going to be your grant compliance guru. So anything regarding your budget, allowable costs, program activity changes, etc., those all come to me. Now, what can you expect of us? You can expect that we will support and assist you as you set out to reach the goals and objectives you proposed in your applications to us. We want you and your staff to have the necessary tools to serve this critically underserved population to help your communities. We will provide quality technical assistance through the Council of State Governments Justice Center. Some of you know the Council of State Governments as CSG. That's what we usually refer to them as. But they're going to be your technical assistance provider. And each of you will have a TA coach. If you have not yet heard from them already or spoken to them already, you will soon. And we expect that they will challenge and support you. So a little bit about OJJDP, if you don't know that much about us already. Our office was actually established by the Juvenile Justice and Delinquency Prevention Act of 1974. And we are mandated to support through that act to support local and state efforts to prevent delinquency and improve the juvenile justice system. That's really broad. But I like that it's broad because we can tackle a whole lot of different areas in the juvenile justice system. So we are a component, one of many components of the Office of Justice Programs within the U.S. Department of Justice. And we work to prevent juvenile delinquency, improve the juvenile justice system, and of course, to protect children. We accomplish this mission by supporting states, local communities, and tribal jurisdictions in their efforts to develop and implement programs for juveniles like the ones you all have right now. The office strives to strengthen juvenile justice system's efforts to protect public safety, hold justice-involved youth appropriately accountable, and provide services that address the needs of youth and their families. That's critical, and their families. As recipients of this award, you each share a common goal to effectively serve youth with mental illness and co-occurring disorders in your local jurisdictions and to create positive system-wide change for youth with mental illness in the justice system, alongside many other professionals across the nation. So congratulations again. We look forward to working closely together to ensure that each of you succeed and stay on track with your awards. So with this brief introduction, I will introduce it over to Dr. Aisha Delaney-Brumsey to talk a little bit more about the CSG Justice Center, the history of the Justice and Mental Health Collaboration Program, and provide critical context about people and youth with behavioral health needs in the criminal justice system. But you will hear a little bit more from me later. Aisha?
Hi, thank you so much, Catherine, and I'm glad to be with you all here today. Congratulations again on your award. We're so excited to be working with you. So as Catherine said, I'm just going to give you a little bit of a background on the Council of State Governments Justice Center. So for those of you who are not familiar with us, we're a national nonprofit, nonpartisan organization. We combine the power of a membership association representing state officials in all three branches of government with the expertise of a policy and research team focused on assisting others to attain measurable results. Our staff develops research-driven strategies to increase public safety and strengthen communities. Next slide, please. So this slide here describes a bit more about our work style and how we strive to reflect the Justice Center core values, which are a commitment to being independent and nonpartisan in every aspect of our work, providing rigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and being inclusive and respectful of diverse views and experiences. Through the Juvenile JMHCP, OJJDP aims to help states, local governments, and tribal organizations improve responses to and outcomes for people with mental illness or co-occurring mental illness and substance use disorders who come into contact with the criminal justice system. And also to support public safety by facilitating collaboration among criminal justice, juvenile justice, mental health, and substance use disorder treatment systems. JMHC funding was reauthorized through the 21st Century Cures Act. Included in this bill is a range of initiatives, included in this bill's range of initiatives are several criminal justice reform measures related to the issue of mental health. And we believe that this bill is really a milestone in the fight to address mental illness and substance use in the criminal justice system. Since its inception, there have been 568 awardees from across the nation, representing 49 states, 2 U.S. territories, American Samoa, and Guam. And we're proud to have worked across the country to support local programs. Indeed, nearly $164 million has been awarded through the JMHCP grant program to improve public safety and responses to people with mental illnesses and co-occurring disorders in the justice system. And we're excited to have an increase in funding for this year. So by way of some context, and really all of you are familiar with this because you're in the room doing this work, but there's real national awareness right now of the growing and really persistent crisis of people with mental illness in the justice system. And as you all have recognized, and it's widely reported about the many challenges for both the individuals themselves as well as system actors like law enforcement, jails, courts, and other people addressing mental illness and substance use disorders. And the data I'm going to show you now, it focuses primarily on the adult system, but there's real analogies to the youth and juvenile system. But what we've known for some time now is that people with mental illnesses are really overrepresented in the justice system. And one of the seminal research papers on this topic found that the rate of serious mental illnesses in jails was 3 times higher than that in the general population. And of the people with serious mental illnesses in jails, about 3/4 of them had a co-occurring substance use disorder. And this really highlights the importance of both addressing mental illness and substance use and having integrated behavioral health supports to meet people's needs. And this next slide just talks a little bit about how we know that this challenge touches each point of the criminal justice system, starting as early as law enforcement. And what we know from data from local systems is that law enforcement across the country is spending more and more time and resources responding to calls involving people with behavioral health needs. However, across this country, there are often inconsistent standards for mental health and de-escalation training. And the light blue bar here indicates that there's one state, that you see here, with no mental health or de-escalation training standards. And among the states with standards, there's inconsistencies on the number of hours of required training. Indeed, 10 states have no specified hours, and the remaining have really varying hours. What we also see is that in places such as Madison, Wisconsin, behavioral health calls for service take twice as long to resolve than non-behavioral health calls for service. And evidence shows that when officers are trained in mental health and de-escalation training, fewer individuals experience mental health or behavioral, fewer individuals who are experiencing mental health or behavioral health crisis are arrested and put into jail. For example, this data here from Oregon found that their service coordination team, when they responded to calls, only 2% of individuals were arrested. Moving a little bit further down the criminal justice continuum, in our court system, judges may sentence people to jail or prison in an effort to get them connected to needed treatment services or mental illnesses and substance use disorders. This is highlighted here in the survey that we conducted that shows the perception of judges in North Dakota that sentencing someone to jail or prison was one strategy that they used to help people get needed support. And what we're really seeing is that judges are trying to help find solutions to keep people, get access to care for people, and that this strategy is one, but many judges are working on ways to keep people out of the system and connect them to care. So now I'm going to turn it over to Sarah Wurzburg, who will provide us with an overview of the behavioral health diversion and reentry strategies using a systems focus as you consider the work in your community. Thank you.
Thank you, Aisha. So we've learned a lot from the past decade of working with Justice and Mental Health Collaboration Program, both on the juvenile and adult side. So just love to share a little bit about what we've learned and how we think about and approaching this work. There's a lot of questions that still remain to be seen, particularly with youth interactions with law enforcement and how, when this is a subpopulation of everyone law enforcement interacts with, how to elevate the issues of youth, particularly those with mental illnesses. Really thinking through how to implement coordinated approaches that respond to both youth and their families in a comprehensive way, and trying to identify youth with mental illness and substance use disorder in the system, and then thinking about other crisis service options that could be used as potential alternatives to youth involvement within the juvenile justice system. Next slide, please. So when we're thinking about this, we really think about taking a systems level approach and really looking across and thinking about how to move from individual one-off programs to a system-wide strategies that are encompassing of diversion options for those who might be appropriate, who can be better served in community-based mental illness and substance use care, and then comprehensive services that could be available if a youth is detained, all the way through reentry to make sure they're reintegrated into the community and move towards the support services they need, as well as a crime-free life. Next slide, please. So when we're thinking about diversion, there are so many opportunities, and an exciting part about the cohort within the Juvenile JMHCP grantees is that you're really looking across these different areas in different ways, but thinking about options for law enforcement first contact and how you can actually identify youth who might be having behavioral health challenges, looking at the youth detention and the screening and assessment processes for youth with mental illness and substance use disorders, thinking through court responses, whether it be through a specialty court option or just through identification and support services. And how do we really make sure these connections to the juvenile justice system are clear between community-based supports and providers that can include case management, substance use and mental health treatment, supportive housing options if needed, or support for families in the housing, as well as vocational and educational pieces. Next slide. When we're looking at this intersection, there's actually a lot of overlap in what we talk about between behavioral health and juvenile justice, because so many youth within the juvenile justice system struggle with mental illnesses and substance use disorders. So this system coordination is really the linchpin of Justice and Mental Health Collaboration Program, and something that all sites continue to work on, as well as thinking through what are some of these key principles that actually cross the behavioral health and juvenile justice system. And I think one of those is really thinking about how to approach youth in a developmentally appropriate way, so it really addresses where they are and where they are within their development. Taking a family-centered approach, so making sure that the family unit as defined, is really a focus of the care, both from the behavioral health and the juvenile justice side. And then being community oriented. What works in one community might not work in another, although often we're able to connect you with peers who can tell you how it worked in their communities, and then you're able to tweak some of those options. Next slide, please. So there are some core principles for reducing recidivism to improve outcomes for youth in the juvenile justice system. We wanted to talk a little bit about some of these core principles. So when we're thinking about this, the first piece of it is really around the risk needs responsivity framework, and that how that can help juvenile correctional agencies to improve outcomes of youth. So considering the use of risk assessments that could be validated to think about the different risk factors which would make youth most likely to reoffend, the need principles or the needed services to address the delinquent behaviors, substance uses might be one of these pieces, and then the responsivity of how to really focus on the strengths and how you can most effectively respond to the treatment options. Next slide, please. The second piece of this is really thinking about how to adopt programs that are specifically focused at recidivism reduction. So in the behavioral health side, we know we have a bunch of options that are good for this. There are many family-based therapies and treatments, such as multidimensional family therapy. There's adolescent community reinforcement approach. There's assertive continuing care. There's 7 challenges. There's also different options to address criminogenic risk factors as well, such as, thinking for a train. So we know there are some options there. But the big piece of this is not just in the selection, but then really thinking about how to implement quality assurance mechanisms to make sure you're getting the right match for the youth and the right youth are being directed to the services. And then also thinking about how you're tracking that and how you know these services are effective, because it's very hard to actually implement with fidelity to these evidence-based practices. Next slide, please. When we're thinking about youth treatment, there's a bunch of things to consider. We have the screening and assessment processes. So how do you identify the youth in the first place who need these mental illness and substance use services? There are really considerations on what services are needed and how to integrate that care in a collaborative way. So how do you really make this collaborative, comprehensive case planning approach, which includes the behavioral health needs and the criminogenic risk factors, as well as other needs that might be for the youth and the family there as well. Really thinking about the family engagement pieces and family involvement within treatment, thinking about better strategies to retain the youth in the care that they need. Also, just from a staffing perspective, as you're building these programs, how do you staff up with qualified staff who understand developmentally appropriate care? How do you train them to work with youth and their families most effectively? Are there additional gender and cultural factors that can be considered in the development and the selection of programming and the continuing of recovery support services for the youth? And then going back to the treatment outcomes, how do you know that the treatment that you've selected is actually effective for the youth through these programs? So these are all long-term strategies and goals that we'll be working with you on. Next slide, please. So the third piece is really thinking about how to coordinate across systems. And I'm sure some of you are familiar with this, but about 60 to 70% of youth in confinement have a mental illness. About a quarter to a half have a substance use disorder. Over 65% of youth on supervision have past or current involvement in the child welfare system. And they also struggle with some of the educational attainment pieces. So that's often already 4 systems that you'll be coordinating with on these efforts. And sometimes there are additional systems involved in that too. So really thinking through the systems coordination piece between the mental health and the juvenile justice system, but also some of these other systems that may be involved with the youth and their family as well. Next slide, please. And then finally, just to reiterate on this point, is really thinking about the developmental needs of the youth. So what is their, for the youth, they have significant influence factors from their peers, from their schools, from their families and communities. How can you help them engage in pro-social activity and services that will support them and be appropriate and help them regulate their impulses and emotions, which are big issues for youth as they continue to grow up. Next slide, please. So when we're thinking about some of the key challenges that we've learned from some other sites over the past decade, it's really thinking about how to systematically track and use data. So I know I mentioned that a few times, but this is something that is really hard to get right and something that sites always struggle with. How do you identify the youth and then track their outcomes as they move through the system? How do you think through different gaps that might be in the community for the treatment system? So what if there is treatment that's not available for the youths with mental illness and substance use disorder? Really thinking through multiple opportunities to support the youth if there are diversion opportunities or crisis response opportunities that are alternative to the justice system. And then thinking about the coordination, as we already mentioned, between all of the youth serving agencies. And this is always a big piece of the work. Next slide, please. So then at the practice level, one of the big struggles that continues to happen in the field is how do you actually address the behavioral health needs and the criminogenic risk factors in a coordinated way? How can you incorporate the assessment information into the case plan and really make sure these factors follow the youth throughout their involvement within the system? And then implementation of evidence-based practices and keeping that to fidelity and the quality assurance pieces that are needed to do that. And the ability to really use data to support changes in practices. So how do you know if something isn't exactly working and you can work to tweak it and improve it so the outcomes for the youth and their families get better? Next slide, please. So in order to address some of the pieces related to criminogenic risk and behavioral health needs, a while ago we developed this criminogenic risk and behavioral health needs framework. So really thinking about the criminogenic risk levels, low versus medium to high, looking at the substance use since that's a criminogenic risk factor, and the mental illness, and then thinking about different services the youth would need depending on their level of risk, but also the level of behavioral health need. Next slide, please. From an implementation perspective, we developed a web-based tool that actually gets at the criminogenic risk and behavioral health needs of pieces that really coordinates these pieces together. Next slide. And a big concept that I think we'll be discussing is really about lead case planners. So who is the lead for the service delivery for the youth and really trying to coordinate one plan for the youth and that family. So this example actually has the lead case planner as a juvenile probation officer. And these little pieces of the pie talk about all the different people that might be around the table to help support this youth in the case planning process. So the youth and their family, it could be child services agencies, the court system, education providers, vocational providers. So there are so many different options for how to do this. But it's really important to think about who within your grant system is going to be the primary person who's responsible for gathering all the information and trying to bring that together into one plan for the youth. And I think with that, I will be turning it to Catherine again.
Great, thanks, Sarah. So I'm going to kind of provide an overview of the Juvenile Justice and Mental Health Collaboration Program, all of which was spelled out in the solicitation that each of you responded to and received an award. But I think it's a good idea for us to kind of refresh and kind of come back to those goals that we should all be focusing on with our programs. So as stated in the solicitation and ultimately in the statute that is providing each of you with your award funds, the goal of the Juvenile Justice and Mental Health Collaboration Program is to improve responses and outcomes for youth with mental illness or co-occurring mental illness and substance use who ultimately end up coming into contact with the juvenile justice system. So what that can look like actual contact with the justice system, or maybe it's just contact with law enforcement before they get into the juvenile justice system. This year, We had 8 juvenile justice and mental health collaboration program grantees. That is you. You are a small little cohort of many grantees that received of these funds on the adult side. But you guys are special because you're with me and you're doing some juvenile justice work. So congratulations. You each received the same amount of just over $600,000, and a total of almost $5 million was awarded just to juvenile justice efforts. So that's great. Next slide. So as you know, each of you are expected to work in a 2-phase process. Phase 1 consisting of a relatively short planning, but very important planning period, and then a second phase, which will be your implementation phase. The total cycle is going to be 36 months. But again, as I mentioned in the beginning, some of you may need a little bit more time, but hopefully you will be able to get to all your goals and objectives at the end of 36 months. Next slide. So we expect that your planning phase will be between 4 to 6 months. I know that that is kind of flexible because most of you have not even received budget approval and haven't even been able to start your grant activities. So that is flexible, but once you are able to get rocking and rolling after your budget approval, we expect that your planning period will be about 4 to 6 months from the date you get your budget approved. Just so you are in the know, only about $50,000 of your grant funds are expected to be used during the planning period. Once you submit a plan to me, which would be submitted as a deliverable, I then make sure that you then get access to the rest and remaining of your funds so that you can start your implementation activities. Next slide. So during implementation, I think I've already, sorry, next slide, because I definitely already went over that. Next slide. All right. So grant activities. So just as an overview, this was also in the solicitation, but these are the various different areas that grant funds can be used for. So some of you are going to have proposed a mental health court or a court-based program serving youth. There are some programs that are offering specialized training to officers, employees of juvenile justice agencies, and or mental health personnel in order to assist them in better responding to youth with mental illness or co-occurring mental illness or in substance abuse disorders. Some of you are proposing programs that support collaborative efforts between juvenile justice and mental health agencies to promote public safety by offering mental health treatment services and, of course, where appropriate, substance abuse treatment services for youth with mental illness or co-occurring mental illness and substance abuse. And then lastly, some of you are proposing programs that support intergovernmental cooperation between state and local governments to address enhanced support to youth with mental illness and co-occurring mental illness and substance use at a system-wide enhancement level. All right, and with that, I'm now going to turn things over to Demetrius, who I think has tackled his technical issues for the next topic that we'll cover today, which is an overview of the Juvenile Justice and Mental Health Collaboration Training and Technical Assistance.
Thanks, Catherine. Juvenile JMHCP, which we commonly refer to TTA, provides each grantee with a TA coach for the duration of the program, opportunities for peer learning, access to experts in the field, and further resources and tools. Each TA coach will provide their respective grantees with individual monthly calls, guided TTA through the P&I guide process. The P&I guide process is what we refer to when we talk about the planning and implementation guide, which I'll be discussing further in the presentation. A juvenile-focused learning community, access to expert TA consultations, which will include other CSG staff and subcontractors who have specific subject matter expertise in a particular field, as well as connections to peer-to-peer learning. In addition, you and your team will work with your TA coach to develop a TA plan to include goals and action steps to help your grant program move forward and meet deliverables on time. When developing your TA plan, we would like you and your team to reflect on any areas of program development that you would be interested in receiving technical assistance. For example, refining your evaluation plan, training and supervising staff, developing a process and template to be used for case planning, and or identifying ways for sustainability. Throughout your grant work, you will work with your TA coach to review and update your plans regularly. The last part of your actual planning and implementation guide, the P&I guide, is specifically focused on the area to develop your TA plan. The planning and implementation guide was created in part to support grantees in developing and refining their initiatives, foster discussion on best practices, identify considerations for your collaborative effort, and to help your work through decisions and implementation challenges, as well as for you to understand the status and progress of your project, the types of challenges you are encountering, and the ways your TA coach might be helpful with you in making your project successful. The Juvenile has its own P&I guide with questions specifically designed for this focus area. In addition to the above opportunities provided, you will also have the opportunity to attend a learning community that is solely focused on juvenile work. There will be two other learning communities, one on high utilizers and the other on data collection, information sharing, and evaluation that you will also have the opportunity to attend. Our learning communities are led by both CSG staff and subject matter expert consultants. And the learning communities have independent sessions and are opportunities to connect with and learn from peers and experts in the field. Finally, please subscribe to our monthly behavioral health newsletter using the display page, where you can get continued information on the going-ons of the Justice Center. Now we will begin the question and answer portion of the webinar. We will respond to as many questions as possible in the time remaining. As a reminder, you can chat in your questions in the Q&A box at the bottom right-hand corner of your screens. Also, as we are taking questions, we will advance the remainder of our slides, which have information about the upcoming and final part 2 of the Juvenile Orientation webinar series, key references and resources, as well as contact information and CSG Justice Center newsletter sign up. Another reminder is that this webinar has been recorded and will be posted alongside the slide deck on the Justice Center website. With that, let's begin the Q&A portion of the presentation. Any questions? One question that we did receive, and I think that I'm gonna ask Catherine if she can answer this question. If not, we can always put you in someone in the program side who may be better to answer the following question. Catherine, the question is, do you know when we will hear more about our budget approval?
It's always a $1 million question, and I really wish that I could be able to give you an exact date, but that's never how it is. Every year I'll get a random email from one of the financial analysts in the financial office at the Office of Justice Programs that they have conducted an initial review of so-and-so's budget, and I have to reach out to you to get budget revisions that you then send back to me. Some of you have already gone through this process, and some of you haven't even begun this process. And then I send back, I upload your revised budget, and then you're literally put back in the financial analyst queue. They could have a stack of 50 other budgets that they're trying to review. Just to keep things in perspective, there's one small financial office that is tasked with reviewing and approving the budgets for every single bureau under the Office of Justice Programs. So BJA, OJJDP, NIJ, all of the different agencies that are awarding awards, there's one small financial office charged with reviewing and approving all of the budgets. So that being said, I'm hopeful that all of the budgets will be cleared no later than the end of January, but budget approvals have pushed into February and March in past years, and given all the challenges and craziness with just grants and onboarding, which all of you experienced this year, which I apologize. I know that was a large headache and still continues to be for some of you. It's kind of just pushed everything back. That being said, I keep mentioning that if you guys are going to need additional time at the end of the 36 months to complete the goals and objectives of your program due to budget approval delays, et cetera, those are generally granted. So don't panic that you haven't been able to start activity yet. It just might mean you have to push your programs back a little bit. If you're struggling financially and this is becoming a financial hardship, though, please directly reach out to me and we can have a sidebar conversation.
Thanks, Catherine. Another question that we had that I think that I can answer is, when will we receive the planning and implementation guide, and how long does it typically take for the guide to be completed? If, as Catherine said at the beginning of the presentation, if you haven't already heard from your individual TA coaches, you will be hearing from them soon. And as the previous slide just showed, next week on, I believe it is the 13th, you will have your second and final Part 2 orientation, where you will really be going on more specifics into the different sections of your P&I guide. Around that time and having your first call, and sometime between now and on this webinar, you should be receiving your P&I guide from your TA coaches. At that time, you can begin working on your P&I guide. Typically, what we say, it takes about 4 to 6 months. Sometimes it's longer for grantees to complete their P&I guide, but on the average, it's for 4 to 6 months. And again, just wanting to elevate that, you know, your TA coach is really there to help guide you through the completion of your P&I guide, to really take advantage of their expertise and their support. We find that those grantees who lean on their TA coaches for completion really do complete it in a good time. So again, about 4 to 6 months in completion of your P&I guide, which you will be discussing in more detail on your next and final webinar, Part 2. Without other questions.
Demetrius, this is Catherine. I did get one question from a grantee today that I think would, the response and answer would probably benefit everybody. So for those that have not received budget approval, or for those of you who haven't even been able to accept your award yet, which yes is some of you because of Just Grants headaches, the question was, well, do we still need to submit a performance report for this most recent reporting period, which is technically due at the end of this month? And the answer is yes. What you would write up is a brief narrative, a paragraph or so, saying why you weren't able to conduct any grant activities this past reporting period, whether it's, for all of you, it's going to be because you haven't had a budget approved, therefore you haven't been able to start activities. But you can also maybe use it as an opportunity to discuss, if there's anything you're doing in the interim to be able to hit the ground running once you're able to get that budget approval. But you're going to submit a short paragraph on a Word document that you upload as an attachment to the performance report and hit submit. So you will have to submit something that basically just says why you weren't able to conduct any grant activities. It's just a formalization, but you still need to make sure you submit that.
Thanks, Catherine. Another question that we received was, will we be able to receive information on other programs funded in your cohort? Yes, you will be able to receive this additional information. Again, this type of information about other grantees is really helpful when it comes to peer learning. In fact, a portion of the second webinar will be really spent on you all really getting to know each other and introducing your programs and those who are supporting on your programs. And the really special or good thing about this, because you are such a small group, we think that, during that orientation, you all will be really have some time to hear what the others is doing and really be able to lean in and hear from the other grantees in your cohort. Any or what other questions you may have? Okay, so if we don't have any other questions, we can wrap up. I think next steps, again, remember that if there was anyone on your team or any of your partners who wasn't able to attend, please let them know that next week I will be circulating a link of the recorded webinar to all of the grantees, so you should feel free to forward that information to any of your partners who weren't able to participate in the call. If there were any questions that you wanted to ask or think of after this, Catherine and I both shared our contact information. Please feel free to reach out. If you've already heard or soon will be hearing from your TA coach, you should also feel free to reach out to your TA coach. They may be able to answer questions or help fill those questions. And then, again, a reminder that on Wednesday of next week, I think that is the 13th, you will be having and participating in your your Part 2 webinar, where, again, you'll learn more about and from your other grantees in your cohort, as well as get more information on the P&I guide and the process. So, again, I want to thank everyone for participating, and congratulations again and being awarded for your grantee. We look forward to working with you and continuing to do great work in the field. Thanks, everyone, and take care. Have a great day.